Well, I hope you're doing well, Dan, Polly. Thank you very much for joining us this morning. So let's get started. This first session is on contact tracing applications in Canada and abroad, mostly abroad. We have two presenters, and then we'll have the Q&A after the two presentations. Please use the chat function on the right-hand side of your screen to ask your questions. Ask at any time. Both Dan and Polly can see all the questions throughout the session, so they can choose to respond to them right away, or we'll have a dedicated Q&A period at the very end of the two presentations. So the first presentation will be discussion will be by Polly Sanderson, who's a policy counsel at the Future of Privacy. Polly's done some really interesting work on contact tracing, and we will send links to some of this afterwards as well to everyone, and done some very informative comparisons of different applications. And then the second presenter will be Dan Bogdanov. Dan is the inventor of ShareMind, which is a secure multi-party application. It's used quite extensively in Estonia and other countries to enable secure digital government and other types of applications. He's also involved in the development of contract tracing applications in Estonia and in other European countries. So I have some, I'm going to be making some really good points, two excellent speakers. I know they have a lot of material to cover, so I will let them get started right away. And we're looking forward to all of your questions as well over the next hour. So with that, please, Polly, I'll hand it over to you. Thank you.
Thank you, Khaled, and thank you so much for having me today. I'm really, really glad to be here. So, you know, as Khaled kind of already kindly gave me an introduction, my name's Polly Sanderson. I'm at the Future of Privacy Forum, and we aim to kind of bridge the gap between policymakers, industry representatives, and consumer stakeholders in order to create pragmatic policy on emerging consumer privacy issues. So it's really, really difficult to know where to begin with this topic. There's been so much reporting in the media about this topic lately. There have been legislative proposals in the US. There have been different types of debates around the world. And Dan and I have kind of decided to break it up a little bit so that I kind of focus on the US perspective a little bit more, and then Dan will speak a little bit more about the EU perspective, as these are kind of our areas of expertise. So when thinking about contact tracing, there are a bunch of different factors which need to be considered. At this stage, the scientific understanding of the disease itself and also different methods and designs for contact tracing is still emerging. And I think the most important thing to say from the front end is that designing these applications needs to be evidence-based. And as our understanding of the disease and of these applications and the implications for our privacy and other civil liberties evolves, you know, the design needs to be able to be flexible in order to evolve to changing standards. Now, I'm going to talk a little bit about public acceptance and adoption, which is also another key factor. I think a lot of us have probably heard that 60% of the population need to download these types of apps to be effective. And I'm going to kind of question that narrative a little bit. Technical capabilities and effectiveness, you know, these are not a silver bullet solution, but they could be effective to reduce the rate of R to a certain extent. And you know, I just want to emphasize that as they're not a silver bullet solution, they need to be deployed in combination with lots of other different measures to combat COVID-19. So I'm going to talk about the legal issues, the ethical values and principles, and we'll get through this. So before I do jump into that, though, I really want to emphasize that these apps are not a silver bullet solution. There are so many different technologies that have been deployed and are being deployed around the world with varying effectiveness and varying privacy implications to combat COVID-19. And here are just a few examples of different interventions. And each of these needs to be analyzed critically from a privacy perspective, but a lot of attention is being given to contact tracing apps. Now, just diving into the different types of apps that have been deployed, you can see here at the bottom that these two final apps, contact tracing apps and exposure notification apps, that I've highlighted in a red box, are what I'm going to be speaking about today. But this is just to emphasize that there are many different types of apps that are out there. There are symptom tracking apps, there are research apps, there are quarantine enforcement apps, digital telehealth management apps. And sometimes these functions get bundled together inside one app, in varying combinations. And IDAC, it's the International Digital Accountability Council, which is a recently launched digital watchdog, recently did a study of 108 different apps around the world, and I recommend everyone to go and read that study. Now, as I'm the first speaker, I want to lay some kind of groundwork, do some definitions. The difference between manual and contact tracing. First of all, manual contact tracing is something that's been around for a long time. It is where case investigators speak to an individual, build trust with the individual, and then ask where they've been and who they've been in contact with, and then follow up with those contacts. And this is what lots of states in the US are focusing on, quite rightly. And there are lots of different ways that technology can support manual contact tracing efforts, such as case management systems, data broker services to be able to identify and trace individuals, chatbots to talk to people, and Salesforce is helping with these efforts, and lots of other big tech companies are supporting manual contact tracing efforts. However, despite all of the technical support in the world, there are still limits to manual contact tracing. We have never, ever had to deploy contact tracing at this scale before. In the past, it's been deployed for, STIs, different types of diseases, but never on this scale. So there are scalability gaps and resource gaps. Lots of people are being hired right now, and they're going to be working from home and cold calling people. Some people are more comfortable with receiving phone calls, whereas others would prefer to receive emails or mail or even communicate via an app. There are memory gaps. I mean, I can't remember who I was in the line with 2 weeks ago at a grocery store. And it's almost impossible to identify strangers. And then obviously trust issues. So to overcome some of these limitations of manual contact tracing, automated contact tracing and exposure notification apps are one of the ways that we can kind of fill in some of these gaps. And so, depending on the design, there are many different kind of trade-offs in the design. And I've kind of summarized these here, but Dan is going to go into more detail about like the politics of some of these trade-offs, especially in Europe, where centralized versus decentralized has been a major area of contention. So, just to give you some basics, centralized is where the personal information is stored in a kind of government server or another server for public health authorities to use. And so this might be able to increase the effectiveness of contact tracing by actually knowing where people are physically, so you can identify hotspots. However, it is also really revealing information. It can also help to with analysis about the way that the disease is spreading in general. But the decentralized version is kind of peer-to-peer. So there's the processing and matching happens on individuals' phones. Now, another trade-off is Bluetooth versus GPS. Now, Bluetooth could be used to identify relative proximity between two devices, whereas GPS location is more revealing, as I already said. Voluntary and mandatory, I'll get into that a bit later. A few countries have mandated these apps, such as India and Turkey, but most countries have kept them voluntary. But even within the voluntary types of apps, there are lots of different ways that these apps can be incentivized. And then depending on the design and epidemiological evidence, public health authorities can choose to design their apps so that they process either only confirmed diagnosis or self-reporting. And there's a debate there as well. So these are all different key areas of debate. So I've kind of tried to break it down a little bit. There are many different types of apps and types of designs out there, but Hopkins have broken it down according to, there is a minimalist approach, which is kind of exposure notification. The DP3T group in Europe, I'm going to leave that to Dan to speak about, and the Apple-Google protocol. And this has been a popular option for lots of different countries around the world and also states in America. About half a dozen or more states have kind of adopted the Apple-Google protocol so far. Oh, sorry. Oh my goodness. Sorry about that. Okay. And this is where Bluetooth signals are used to record proximity. It's stored on device. It's fully anonymous and fully voluntary. And this works kind of alongside manual contact tracing and parallel to it, but it's not augmented with manual contact tracing. It doesn't actually, no data is actually available for public health authorities to support them, but it supplements it in parallel independently. And then there are lots of middle ground approaches where different types of data may be sent to public health authorities. So these types of contact tracing apps support public health authorities and kind of augment with manual contact tracing to different degrees. So at one end of the spectrum, public health authorities might receive only fully anonymized and aggregated personal information. And then at the other end of the spectrum, there might be government servers with personally identifiable, individualized information in there. And so, you know, there are certain pluses and minuses to either approach, you know, in terms of like trust and effectiveness and privacy. I just wanted to kind of highlight that within this, this kind of middle ground, diverse range of approaches where lots of data is actually collected by public health authorities, there's a risk of data actually flooding the system and overwhelming the system, which is something that we should probably keep in mind and learn from 9/11, where so much data was collected on the population that it actually became more difficult in some circumstances to identify terrorists because there was actually an over collection of data. And then at the maximal end of the spectrum, there are lots of kind of countries, especially in Asia, that have really adopted a kind of very data-driven approach towards combating COVID-19. And although in lots of ways that it has been effective, it's also kind of interfered with privacy in ways that just wouldn't be acceptable in a liberal democracy. And so I'm going to focus on the two kind of more left sides of the screens. But before I do, I just kind of want to lay the groundwork in the US. So as I've mentioned, there are a number of states that have decided to go with the Apple-Google API, which I'm going to describe in a moment. None of these apps have launched yet, so this is all kind of emerging, and it's difficult to, the evidence isn't in, basically. However, perhaps more interestingly, there are a number of states that have completely rejected the idea of digital contact tracing at all, and especially the Google Apple API, because they want to go their own way. And so a lot of states are actually focusing on ramping up their manual contact tracing efforts with the support of technology in different ways. There are a number of states that are undecided at the moment and are still considering their options. And then some states have gone their own way and they've created contact tracing apps but they haven't adopted the Google Apple API. And so there's like a really fragmented landscape in the US when it comes to this topic. And I think that the closest thing that we kind of have to a unified approach in the US, in the absence of that much federal guidance or federal support, is the Google Apple API. And so that's what I really want to talk about next. First of all, Google and Apple were not a first mover in this space. They were responding to requests from governments and public health authorities and European researchers and scientists who were trying to develop their own Bluetooth-based kind of privacy-preserving exposure notification and contact tracing applications. But we're running into some troubles because of interoperability issues between Apple and Google devices. Because of like privacy protections that have been put in place over the years to prevent stalking and harassment and abuse by governments, Apple and Google devices actually have inbuilt privacy protections that stop Bluetooth from always scanning. So you can't have it always on. And so Google and Apple entered into a technical partnership in order to kind of overcome these interoperability problems for this limited use case to make their Bluetooth proximity tracing more effective. And I've already kind of described the technology of how it works. It uses rotating Bluetooth identifiers, which act as beacons, and they identify one another. And then the information that is collected is stored on users' devices rather than in a central server. And then if someone becomes infected with COVID-19, then they can voluntarily send all of their rotating Bluetooth identifiers to a central server for other people's phones to check against. And so it's anonymous. And so the reason why Apple and Google kind of chose this really privacy preserving approach is because they, number one, the Federal Trade Commission in the United States, FTC, for years has been advocating for privacy by design. And this is a really privacy preserving technique to use. And so it's kind of unsurprising that they have developed a really privacy preserving method. And also they felt that by increasing privacy, they will increase trust, which will hopefully increase adoption, thereby having a knock-on positive public health benefit at the end of it. And finally, because of the surveillance capabilities, if they completely opened up the permissions and the potential for abuse by foreign governments, because this is a technical design change which is global. You can't just kind of pick and choose, like, I trust Canada, I trust the Canadian government, I trust the French government, they have adequate data protection frameworks. You can't pick and choose when it's a technical design change, it's global. And so they wanted to be careful and respect human rights. But not only the technical side of things, there are also important terms of service, which really put restrictions on the types of apps that public health authorities can apply to use this API. So number one, only public health authorities are able to use the API, and it's limited to one per jurisdiction. No GPS location data may be collected by the apps. It must be completely voluntary. And so these kind of really place some restrictions on public health authorities and the way that they design their apps in order to be whitelisted to be offered on the Google and Apple Play stores. And some governments have argued that they want more information, they want more power. And I think that Dan will probably speak more about that from the European perspective. But public health authorities do have certain powers still. So for instance, because they are the experts, medical experts and public health authorities still get to choose how to toggle what counts as a proximity event. And this depends on how long people have the phones have been in close contact with one another and the signal strength. And that's not up to Apple and Google to decide. That's up to public health authorities. And public health authorities also have the option of not using the Apple Google API at all. They still have the option of designing contact tracing apps using GPS location. They just wouldn't be able to use the API. One benefit of the API is that apps that all use it have the potential to be interoperable with one another, which is really important for scalability. And scalability is really important for effectiveness because the virus doesn't have boundaries, doesn't have borders. It's moving across states, especially as the economy begins to reopen. One of the most important things will be that these apps are interoperable with each other in order for it to be effective, which brings me on to effectiveness. A lot of us have heard that 60% of the population needs to download one of these apps in order for it to be effective. Now, this originally came from an Oxford study, but the figure has actually been a little bit misrepresented and misquoted in the media. And it's actually had a big effect on policy decisions in the US. So it's really important to kind of clear this myth up. Although the study said that 60% would be optimal for effectiveness, adoption at much lower levels can actually start to have positive effects on public health outcomes. And there are various factors for effectiveness. So although user penetration is one of them, others are public trust and integration of data sharing and other systems and of the apps themselves, and then cross-border interoperability with other systems. So interoperability is really, really important. Now I'm just going to talk a little bit about public attitudes in the US. There was a recent study done by the Pew Research Center, and there were really mixed results on how Americans see digital privacy issues amid the COVID-19 outbreak. The country was divided on whether the government should be able to collect GPS location data or whether they should be able to track them. And then another study was conducted by Cornell University, which found a high correlation between adoption, privacy, and accuracy. And so not only privacy, but also the occurrence of false positives and false negatives are really, really important to mitigate. So a false positive is where a person is alerted that they might have been exposed to COVID-19 when actually they haven't. And a false negative, which people were actually more worried about in this study, is where people do not receive a notification that they may have been infected, but actually they were exposed. And so these are things that we really need to consider. And there are accuracy issues with both GPS location and Bluetooth. But we need to think about accuracy in terms of relative accuracy compared to how accurate manual contact tracing is and how it could supplement manual contact tracing, which I've already gone over the limitations of manual contact tracing. But GPS location is less accurate in urban areas. It can be interfered by weather, harsh weather conditions, high-rise buildings, it's less accurate. And then on the flip side, Bluetooth, it won't be able to, signal strength will vary depending on whether you're wearing clothes, the orientation of your phone, or whether a wall is maybe between you and your neighbor. And so it's not 100% accurate, but there are accuracy issues with all of these methods that are being suggested. And when it comes to public attitudes, one thing that I really find interesting in the US is that there have been really mixed messages from public figures and trusted community members, which is really interesting, and it might undermine adoption and trust in the US. There has been a really terrible perfect storm that has occurred recently in the US with protests and the pandemic, and law enforcement have been threatening to track protesters. And so lots of consumer advocacy groups such as Consumer Reports have quite rightly been putting out guides for protesters in order for them to be able to protect their phone privacy from law enforcement at protests. And so they've been advising, turn off your Bluetooth, turn off your location services, buy a burner phone. And then at the same time, you've got public health authorities and public health experts saying, download this app, turn on Bluetooth, turn on your location services for public health reasons. And so I'm unsure about how this is going to unfold, but this is just something that I've noticed, and it might undermine some public health efforts in the US at least. Equity and fairness, the discussion really wouldn't be complete without noting that only 80% of Americans actually have smartphones, and there's uneven broadband access across the US. And so there are obviously going to be equity issues. Some solutions have been suggested, such as deploying more smartphones, deploying kind of tracking devices like little necklaces, paying for people's data packages like the government during the pandemic. And then beyond kind of lack of access to adequate technology to actually utilize these apps, some populations are more fearful of downloading the apps in general because of negative experiences with law or immigration enforcement, and concern about negative consequences happening to them, so lack of trust. And then one of the other equity issues, which I haven't seen brought up so much, is the potential negative effect on businesses or people in certain areas that could occur if there are hotspots that are located where it says, right, in this area there is an outbreak, whereas it could be it could be concentrated in a care home in the area and not distributed evenly throughout that area. But if there's a hotspot, people might just avoid that entire area and businesses could be stigmatized. And so that's another issue which I think that we need to think about. And another solution to some of the equity problems is that resources could be deployed to greater extents in areas where there are less smartphones and less people downloading apps in order to try and counter these equity issues. Now, I wanted to kind of pause on voluntary versus mandatory, but I really don't want to take too much time from Dan. But just to say that there are lots of different ways that these apps can be encouraged without actually making them mandatory. They could be mandated as a precondition to enter certain premises, which is controversial. There are different stages where consent could be required, such as installation of the app, processing of positive diagnosis. There are economic or trust-based incentives that could be deployed. Economic incentives and mandating apps as a precondition to enter certain premises, though, could be seen as unfair and coercive. And so I think that especially when the evidence isn't in about how effective these apps are and potential risks of harm, it would be better to focus on trust-based incentives at this point, which is privacy by design, purpose limitation, legal legislation and penalties, community involvement, accountability and oversight, accuracy. These are all the issues that we need to be focusing on. I'm going to skip over this because I really don't want to take too much time, but even though it's an early stage, there are so many principles emerging from different sources. CDC have put out a really quite brief set of principles of criteria for evaluating digital contact tracing tools. There are the MIT principles. Hopkins guiding principles are really, really useful and cool. In Europe, they were actually pretty quick movers with this, I think, considering because they've got the GDPR. There was a whole load of guidance that came from Europe. And obviously the Canadian commissioner put out some principles for contact tracing apps. Now, in terms of governance and oversight, there are internal governance mechanisms and accountability mechanisms. Transparency is really important. Making source code available for scrutiny is absolutely essential. And then external oversight. So there have been some legislative proposals lately, which have, in the US, which have said that the Privacy and Civil Liberties Oversight Board could become responsible for kind of overseeing these types of apps in their deployment, which is interesting because this was a board set up after 9/11 to kind of oversee measures taken to fight terrorism from a civil rights perspective. So it'd be interesting to see that kind of moved over into this crisis. And finally, importantly, I really want to go over some legislative proposals in the US. You can see here that there are already some existing restrictions on organizations that deploy these apps in different ways, but there's a patchwork, and it's really spotty. There have been some comprehensive federal privacy proposals, but these have not been enacted, and there's a stalemate between the Republicans and the Democrats. The FTC commissioner recently has been talking a lot about how she really wished that the US already had federal legislation before the pandemic. It would have been really helpful to provide clarity to organizations about the extent to which they can share data with public health authorities and how to design these types of apps and other methods involving data to combat COVID-19. But alas, that didn't transpire. There have been a few broad COVID privacy bills that have been suggested, but these have actually fallen along party lines. Like the same divides that we've been seeing in comprehensive privacy legislation, we've also been seeing with the COVID bills. And these kind of fall along divisions over whether there should be a private right of action, whether the law should preempt state laws, anti-discrimination provisions, whether publicly available information should be included or excluded. And these all have massive implications for commercial practices and people's privacy. But interestingly, there is actually a bipartisan privacy bill which has been introduced, which is rare for privacy in the US, by Cantwell and Cassidy. And this has a much narrower scope, which might explain why they could find some agreement here. And it would only cover automated exposure notification services. And it actually includes a lot of the same restrictions that the Google Apple API terms of service do. It would limit exposure notification services to there would have to be collaboration with public health authorities for people offering these apps. There's data minimization provisions, transparency, and user voluntariness, data security. So, I mean, that's just interesting. I don't know if it's going to pass or not, but at the moment, there's no national strategy. And so this is just some concluding remarks. We've got two key questions. One of them is, what standards and rules should be put in place? And then secondly, who should be making those rules? Because in the absence of legislation in the US or a national strategy, measures are being put in place right now within companies and on the ground in states. And so that's just one thing that I wanted to leave you on. And with that, I'm going to pass it over to Dan. Thank you very much.
Excellent. Thank you so much, Polly. That was really great. You covered a lot of ground. So Dan, I'll let you take over, and then afterwards we'll take questions. Folks, please type your questions in the chat section so that Polly and Dan will be able to respond when they're finished with their presentations. Dan, please.
Here we are. Do we have a full screen slides? Do these work? If Khaled, can you confirm?
If you put your deck in presentation mode, that should be good.
Okay, that tried that, didn't work. So let me try this again. Let me try a different technique for it. That'll work it out. Right. Here we go.
Perfect.
Pollyanna, that was amazing. That was an amazing overview, and you've really done a marvelous job at studying everything that's going on around the world. I will not be able to cover everything in the same breath as you did. Instead, I'll focus on a more specific story. I'll focus on a story of how privacy won out, in my somewhat humble opinion here. So I'll tell you a little bit about how the contact tracing efforts have been developing in the European Union And Estonia, the country where I'm from, is a member of the European Union, and thus we have seen how this is going on. And there is a bias in my talk. I am, let's say, I like privacy by design. I like to build things using privacy enhancing technologies. So that's my bias, and it will probably show in that talk. But first of all, let's start with setting the scene. So people doing privacy discussions on Twitter were a little bit worried at the beginning of the crisis. So the first few days, I already saw that there were certain parties who said that if we could just get a lot of the data, then we could really tackle the crisis really well and build all kinds of interesting analytical infrastructure or tracking infrastructure. And there were some folks who suggested that this sort of emergency infrastructure would never be dismantled after the crisis ends, whenever that is. The virus is not going away, so will the infrastructure ever go away? There were some very heavy comparisons made. For example, how ID cards proliferated after the Second World War because they were so useful, and so on. So what I saw myself was, I did see a few scientists saying that not opening up health data for research during COVID time could be costing us lives. So I did actually see that also in Estonia, in my own country. And at some point after that, I decided that, yeah, this is probably a time to put everything I've ever learned on privacy technologies and law in action. So quick rewind to March 2019. Every country has had a different path, but in Europe around that time, people were starting to write that China is no longer the epicenter, Europe is becoming the epicenter of the crisis. So countries started invoking emergency powers. That means that the parliaments and governments start saying that, yeah, we're not going to need the parliaments, okay, for everything, we are just going to pass executive orders. And borders started closing, everybody started isolating. So it was beginning of a scary time, a lot of fear in the air. And what happens in the case of fear is people start thinking of solutions. So how could I get everything back? So maybe if I sacrifice some things, I can get it back. So one of the first fundamental rights that was revoked in most countries was the right to go outside, the right of mobility, to move around freely. And now when emergency powers have been dropped, at least in Estonia, then that was a right that you could return. In Estonia today, we can move around with some restrictions, but relatively freely. They're even considering open up cinemas sometime soon. Nightclubs are not going to happen for a while. Neither are music festivals, large ones. But something that you cannot really give back is right of data. So if they take my data during the crisis, then nobody's really going to give it back. They probably don't even know how to do that. What does it mean to give back data? Do I delete it? Will the researchers really delete it once the crisis ends? So one of the success stories in some circles was the Singaporean Trace Together app. It was considered an innovation with potential. It was using Bluetooth. It wasn't using GPS. So that was already a significant improvement. And thus, it was considered as maybe we should look at it. Similarly, South Korean awesome data integration platform that has been going through some of the papers, research papers as well, was considered intrusive yet rather effective in clamping down on the spread of the virus. And that data integration platform wasn't used so much for contact tracing, but for enforcing quarantine. And Israel was announcing an app using GPS data for contact tracing. So actually going the GPS route. So not all of this was Europe. Europe was still looking at what do we do? How do we align ourselves? So one of the first memories I have of uproar in that regard was when the United Kingdom NHS, National Health Service, started considering an app. Researchers in the UK wrote an open letter asking for ethical practices to be followed if that happens. So that was something I remember happening. So there's a lot of links here, and I'll share the slides later. You can click on them if you prefer. So a lot of things happened. A lot of data scientists, data companies who had been amassing data started saying that, hey, we can help you defeat the crisis if you just let us use the data for it. So this here is a diagram drawn from location data, and the link there is there below. That was a company that is collecting quite a bit of location data from a number of sources. They also say they anonymize it. However, there are claims made that location data is not really anonymizable, as has been shown. So that claim is questionable, to say the least. But what this application tells you is how much are people traveling during potential lockdowns. And one could argue that this is an app that can be done in a privacy, not an app, but a function that can be solved in a privacy by design manner. You're not interested in whether a particular person was moving during the lockdown, but you're interested in how well are your restrictions holding? Are you enforcing them strongly enough? So one of the first ideas also in Estonia was that let's use mobile phone location data to start measuring whether people are staying at home. And there was a lot of discussion around that. That was around the time when I started taking positions in the public with regard to this as well. And I argued that you cannot really anonymize mobile phone data, location data. And in the end, what actually happened was something I'm very happy with, that none of the telcos, the telecom operators, actually gave out any location data. The methodology was sent to the telecom operators, who did the aggregation on site in a federated manner, and only shared their view of the global statistics, which the Estonian Statistics Office then aggregated. So that was something where I started saying that, yes, we can actually do this. It's actually possible. Just show a better way, and it will be taken. And I'm very happy for that. At the same time, before the Estonian Statistics Office managed to put out that report, Google was already putting out reports of all the countries based on their Google location history about how much are people moving and how much are staying home. That obviously warrants the usual discussion of why can't the government get all this data if all the people are giving it to Google, which is a common discussion about location data at all times. But so that's a sort of an introduction. This was still in March. So in April, people across Europe started thinking that we should fix this. So I'm calling this slide Privacy Technologists Strike Back. And already in late March, the privacy enhancing proximity tracking project, privacy enhancing pan-European proximity tracking project started, promising a private cross-border app with standards and everything. I considered this a great thing. I engaged them and started looking at whether this is something we can bring to Estonia. In early April, in Switzerland, in EPFL, that's a university in Lausanne, a team called DP3T, the 3 comes from, there should be 3 Ps in their distributed privacy preserving proximity tracing project, made its first GitHub commits. And I have to admit that there have been a number of similar projects, most notably in Boston University and also MIT and so on. So I am not listing all the projects here. I'm trying to see what's stuck in Europe, let's say. And in the privacy circles, people soon started talking that in crypto circles, in the cryptography circles, let's say, it's not only the privacy people there, that the DP3T approach and the Boston University approach seemed to be very good. So that was sort of rumors on the street. Pretty early in April, DP3T and the PEP-PT parted ways over disagreements. And the disagreement was the decentralized versus centralized. I'll discuss that in the next diagram, but this has been something that a lot of politics has been done over. Apple and Google in April also announced their contact tracing API. That was built, at least to some degree, together with the DP3T people, inspired from their work. And their design choices actively hindered Bluetooth-based contact tracing with server-controlled identifiers, decentralized approach. And something I'd like to stress here is that Pollyanna already mentioned how Bluetooth features in iOS and Android to some degree stop contact tracing without the Apple and Google APIs. This is mostly true for Apple and iOS because Google actually lets you do Bluetooth beacons, Bluetooth low energy beacons in the background. But the problem for everybody, including the Singaporean Trace Together app, was iPhones. And iPhones are being in use by quite a lot of people. So technically, they told you that if you want to do Bluetooth contact tracing on iPhones, you have to keep your iPhone unlocked and opened at all times. So you cannot let it go to sleep because then it won't work. That's because of an Apple privacy feature. Google didn't have exactly the same feature. So Google devices could be sent to sleep and they would still do the beaconing and exchange. So April 19th, 300 security researchers, mostly cryptographers around the world, not just in Europe, wrote and signed an open letter saying that there is a difference between the decentralized and centralized Bluetooth-based contact tracing apps, and one should really go for the decentralized ones. And that was sort of now the war was on, let's say. However, at the same time, Norway launched an app using full GPS tracking to track people. And of course, the local cryptographers started fighting against that as well, but I'll tell you in a few slides where that took them. So again, links have been provided below. So let's talk a little bit about DP3T, which on this slide was still called PEP-PT because when this slide was written, DP3T was still considered as a possible implementation under the PEP-PT project. But the slide is very useful, so I've kept that. So think of it as a sort of a very distributed peer-to-peer mechanism with minimal central server control. People install voluntarily the app. This app generates private keys, which stay on the phone. Regularly, let's say every 10 minutes, every hour, every something like that, from that private key, they generate certain rolling keys, meaning that a phone will not have a single ID at all times. If you try to track somebody, they will switch their identifiers every 20 minutes, and then it will be a random new identifier, so you won't be able to track a single phone. However, every other phone will store these identifiers. So this goes on at all times. People walk around, they go to the stores, they sit in trains and so on. The Bluetooth radio signal strengths are measured so that a contact is only registered if you are close to somebody, close being defined by the strength of the Bluetooth signal over a certain number of minutes. Countries define this separately and so on. And then if you're close to somebody for enough time, then your phone stores the identifier that you have seen from their phone. No identifiable records are shared. And if you look at this random identifier, you don't know who it was from. So one day, unfortunately, maybe one of the users will be diagnosed. They will get the cough, they will get breathing will become harder, they will go to a doctor, they will take a test, PCR will say that, yes, unfortunately, you're positive. And then they will have the chance to voluntarily on their phone, under consent, say that I've been infected. At which point their private key, which has been used to generate the random identifiers, will be shared with a server. The server will just get that key and nothing else. There are some alternatives to that design where additional epidemiological, let's say, social graph data would be sent along with it, but that's not a core part of the design. It was sort of to make epidemiology people a little bit happier. And then every other phone, every day, they download the list of these codes from the server and try to generate all the possible rolling codes and see if any of them match what their phone has seen. And if they do, the phone notifies them, and then they follow the instructions from the app and self-isolate and hopefully get tested. There are several important points here. First of all, whether you actually get tested before you can tell that you're ill, and whether then you can confirm with the health authority that you are actually ill. Estonia went down the path that we want to confirm, because the obvious attack is that Johnny doesn't want to go to school, so Johnny takes the app to school for a week, and then Sunday evening says that I'm ill now, and then next week the whole class is cancelled because everybody is going in panic and trying to get themselves tested in Johnny's class. So we don't want to allow Johnny to do this. Neither we want to let somebody put a phone on a dog and let it run around in the park and then virtually infect a lot of the people. So confirming the diagnosis with the health authority has been a key design. However, several countries have not been able to do this because there hasn't been an availability of testing. And if your app tells you that you should go and get tested and the government is not able to test you, then it's a sort of a bad design. So some places have said that, yeah, you just self-isolate and that's it. So the societal implications of all these design aspects are actually huge. So let's talk about centralized versus decentralized now. In the decentralized version, such as DP3T and the Apple-Google API, all the rolling identifiers are generated on the phones. Nobody can bind your identifiers to your phone except for you. In the centralized designs, the server gives your phone the identifiers for distribution. So the server at all times knows which identifiers you have been distributing. That is the design of the Singaporean Trace Together app and several other apps as well. So in the centralized design, the server gives your app the identifiers that you'll be spreading around, meaning that they can effectively track you in some way. In the decentralized design, your phone generates the app, the identifiers. It's a trade-off in the end. In the centralized version, the government can later check the social graphs, understand epidemiology, might be able to give the government more information. In the decentralized version, you get contact tracing. You get just contact tracing and nothing more, unless the person is willing to tell the government more. So from a point of minimization, decentralization would be a sort of a way to go. But there's a lot of discussion on that, attacks on both and so on. There's an excellent security analysis document from DP3T looking at the whole spectrum, if you prefer. So May 2019, and many people in Europe are laughing loud at this, but are Apple and Google the good guys now? Apple and Google finally shipped the exposure notification API as an operating system update, shortened the GAEN, Google Apple Exposure Notification. And it has been rebranded from contact tracing to exposure notification. And that's how it's officially called. UK, France, Norway, and India justify using centralized ID generation for epidemiological purposes. Many in Europe go for on-device ID generation using Apple, Google, or the DP3T, or a combination of both, because DP3T actually implemented a whole framework without Apple, Google, not knowing whether Apple, Google will actually materialize. So they did all the Bluetooth tests. They had the Swiss Army running around in the city with phones and measuring Bluetooth attenuation and signal strength and all of that. It was amazing amount of research. I don't know when they will have time to publish all of that. And countries jumping on board include places like Germany and so on. So pretty large countries are going with this. And some people say how the tables have turned, looking at France and UK trying to convince Apple and Google to make iOS and Android, to remove the restrictions, to make this API also support centralized ID generation, or at least more epidemiological data. But Apple and Google did not cave to that. As such, people started asking the question in the title of the slide. So next step, cross-border. Very important in many countries, smaller countries in Europe, lots of cross-border commuting. In Estonia, we have Finland, we have Latvia, we have a lot of trade, we have people working across borders. We should really fix this. So 10 countries joined up to propose a cross-border interoperability scheme. And Estonia was among them. There's a link to it below. And that would work very well with only the decentralized scheme. Because if you want to make decentralized and centralized interoperate with each other, then you would have to drop some of the privacy from the decentralized scheme. And here you again have to start thinking of, okay, but you want to travel, that's really a sort of a vanity or a comfort thing. Are you willing to give up some of your privacy to travel? Again, it's trade-off time. So the European Commission started coordinating interoperability. They had a working group focusing initially on decentralized solutions because they saw this as low-hanging fruit. We can tackle this early on, and we get a lot of countries to collaborate and interoperate, and then we'll see what do we do with the rest. So Switzerland started tests of their Swiss COVID app based on Google Apple exposure notification API, first in the world. That was the same DP3T team. Their first delivery was indeed to help Switzerland and then help the others. So what next? And this has been a lot of things have been happening. Latvia launched the Apturi COVID app in early June based on Google Apple API. They say they are the first in the world to launch on that API. People would argue whether the Swiss launched first or Latvia launched first. Let's say Swiss tested first, Latvia launched first. Italy launched Immuni COVID app in June. France launched Stop COVID, not based on Google Apple, based on a interesting hybrid centralized design, which was immediately found to have some trouble. In the last week, there have been news in El-Emam, I think it was yesterday or today, where they basically found that if you declare yourself to be ill, then basically all your contacts are being uploaded to the server, which is again, something that maybe you didn't want, but still. The UK NHS tested their app on the Isle of Wight. It was not based on Google Apple, but their app is now missing in action. Nobody has seen anything, basically. This week's news is that Norway's DPA ruled that the health authority has to stop using the app and delete all the GPS data that has been collected. That was a pretty aggressive move, and the health authority voluntarily suspended that app and did this. So Norway might be switching to decentralized or a Bluetooth app soon. We don't know yet. Germany launched their app based on Google Apple yesterday, and they have 6.5 million users as of today. This is pretty good. Everybody knows that Germany is a very privacy-aware country. Estonia plans the launch of Hoia, which is like hold or keep in English, in June, July 2020, based on DP3T and Google Apple. Germany also refers to DP3T on their app website. Belgium is reported to be building on DP3T and Google Apple, and Finland is reported to be doing the same. So this is a sort of an interesting, for me, it has been really interesting to see how we started off with fear, a lot of discussion on whether we should collect all the data and do all the tracking. And we ended up with a lot of countries actually agreeing that we'll take the distributed route. It will help us better in the long run, even though it's Google Apple. And now the interesting discussion here, which I've also seen some of the US privacy researchers arguing that and Apple and Google are not doing a good thing here. And I understand where they're coming from. I have this speculation, and we can discuss it later in the panel, is that in Europe, the whole antitrust power that the European Commission has had, they have shown how they can, in a way, argue with Apple and Google and hold them to justice if they want to, and extract large fines if they want to. There's a certain belief that we can somehow, maybe it's an illusion, not a belief, that control Apple and Google, and that this is actually a good thing, that the design is actually a good thing. Given that Apple and Google are not providing the back-end services, they are actually ensuring that a government has to okay every app, so you cannot have predatory apps saying that they are using the Apple Google API and doing dumb things at the same time. So Apple actually doesn't accept Google as well, don't accept apps into their app stores if they are not from governmental sources. That's a very nice and interesting thing. But we understand that the feeling that Apple and Google are taking away sovereignty from European or US or Canadian or wherever states, that is not a good feeling. And so the question of whether it was a good thing is still out there. Currently, I'm thinking that it was certainly a step in the right direction because it really helped push privacy technologies in the long run. So the next thing is that we'll try to make it work across borders, first in the European Union, and then hopefully around the world. Thank you.
Fantastic. Thank you very much, Dan. This was really a great overview. And thank you also, Polly. So now I think we have, we'll take a few questions. I think the questions have been coming through on the chat. I posted my own questions as well, but I'll start with the others. There's one from Fred about the when individuals are tested and the public health authorities that know that they have been tested, and then individuals provide some kind of verifiable code to the app that they have tested positive. The question is, wouldn't that enable the public health authorities to then link the phone with that code demonstrating a positive test result? Maybe Dan, you can answer that one.
And this is that very much depends on what's the maturity of the whole electronic health record infrastructure in a country. In Estonia, we have the luxury of being a small place, meaning that with us, the same body, the health authority that's doing manual contact tracing is the one operating the digital one, meaning that in a way they would know, by doing the manual contact tracing, they would know this anyway. This information is not something new. It doesn't increase their attack surface. Also, Estonian diagnosis confirmation works based on the National Health Information System, which has these designs in it, has these test results in it anyway. Some would argue that that is a scary thing, that such a system exists, and I do not disagree with them. But then I point them towards a lot of other designs, for example, the Swiss one, which is a lot more federated. Switzerland is a great federation, meaning that then you can just design different protocols. And these different protocols would let you split that information so that you don't need a single central party knowing all of that. But you can split it around, reducing your attack surface, achieving a certain privacy by design. Now, there's again the point that where do you draw the line? Whether it's okay to know who is ill if you're a government health authority, and if this is better than knowing where everybody is at any given time. So this is sort of things shouldn't really be on the same scale, but some people put it on such scale.
Great, thank you so much. Polly, another question I think which has come up in various conversations is these the way these apps are designed, or at least the way they're going to be used, are they creating disincentives for individuals to use them? For example, if you have to self-isolate for 2 weeks, but you have a job or you have to travel or have responsibilities, and then you're required, based on having that app on you, working all the time to self-isolate, which have impact on you. And will this cause individuals to find ways to contaminate the results to avoid these types of consequences?
Yeah, I think that one thing that is important to consider when deciding like what privacy protections ought to be applied, and like whether these apps should be voluntary or mandatory, is like thinking about like the consequences for actually using them, because there are different types of apps. Like some of these apps there are apps out there that are being used for quarantine compliance or quarantine enforcement, which has a much bigger effect on the individual's liberty. So there's an app in Poland, for example, called Home Quarantine, which requires individuals to upload like photographs, and the authorities can text them at any moment, and they'll have to reply in 20 minutes with a photograph of themselves with tags with their geolocation, so that they can prove that they're at home. And I think that has a much bigger effect on individuals' liberty than perhaps another type of app, which maybe would enable individuals to be notified that they have been exposed to someone, and then decide voluntarily whether or not they want to share that information with a public health authority. And then based on the specific public health authority and like their policies, that might then lead to a public health authority recommending that they get tested, or it could lead the public health authority to recommend that they self-isolate. Or depending on which jurisdiction you're in, then it could lead to a public health authority or a government requiring an individual to self-quarantine. And so these all have very different potential impacts on individuals' liberty. And that really depends on which jurisdiction you're in and what the policies are of that jurisdiction. So with the Apple Google API, for instance, when an individual tests positive, their consent is required in order to process that positive diagnosis, even though they've already consented to installing the app. And so there's a lot of control on that individual. But yeah.
Very interesting. Thank you.
Yeah.
I think we're out of time, so I'll try to I'll stop here so that we can maintain the schedule. Thank you so much. This has been really fantastic.